we neuroscientists, we love steroids. So not the steroids that makes, big muscles, but really the ones that helps control inflammation. So the cream you'll put, the steroid cream you'll put. So we like steroids to control inflammation.
Right.
The problem with steroids is that it also makes your immune system weaker. So when we first started the study and we were reacting first as neurologists and neuro-oncologists and giving patients steroids, in fact, we were preventing the poliovirus to do its job. And so we discovered we had another thing we had to readjust. So we had to decrease the dose, we had to stop using steroids, and then we started using a drug, bevacizumab, or the commercial name is Avastin, which is a drug that helps decrease the inflammation in the brain.
Okay.
So really what we say is we decrease the inflammation in the brain with the Avastin, helps while the immune system do its job.
Yes.
And then we tell the patient, everything is okay, I'm there with you, I'm in your corner, I will send you to physical therapy, you will recover from this stroke, your brain will heal, let's keep going. So this patient there, that her brain is squished and it's all very scary.
Yes.
So the 4 months is when we had just started the Avastin. Just saw her on Monday. We're now more than 12 months after the treatment, and she's getting better and better and better and having a great time with her sons.
Oh, wow.
So it is just really, really cool.
Very cool.
So, and we keep moving forward with the study, and that's here a picture of Dr. Gromeyer.
Yes.
And with his lab stuff, and then a picture of him and I at our fundraising and event for the Brain Tumor Center.
Right, because it's not just Dr. Desjardins, it's a team, isn't it?
It's all a team effort. I'm just, I'm the one in charge of the clinical research.
Okay.
So looking after the clinical team, the patient, I'm the defender of the patients,
Yes.
and then I'm the translator also of the people in the lab doing the science, like Dr. Gromeyer.
The translator, so you're communicating the science to your patients so that they understand
Exactly.
what's going on.
Exactly.
And of course, many people here will know that this research got your team a lot of attention. It got you the attention of 60 Minutes.
Exactly.
They dedicated, you said, 2 episodes or 2 segments, to the research that's going on at your brain tumor center. What was that like to be the focus of a television special?
Very interesting. And that's why I'm so excited to be with you today, because first I had never worked with science communicators before, so I had a crash course, of course, trying to explain my science to producers, and explaining and also understanding that the cancer and the patient maybe might not always do in the time that TV show needs, what needs to happen for a good TV segment. So it was a lot of work. 60 Minutes was with us for 10 months, talking regularly, following the patient, answering questions, education, and then it was, I would say, a lot of work, a lot of discussion, and very, very, very interesting and very exciting.
Did you, were you satisfied, or how did you feel about sort of the end product?
I was really, really pleased with it.
Were you? Yeah.
I think I was really pleased, and that, and as the show was going on, I would text my father or text my boss, and say, haha, what you just said there is what I emailed them like 2 weeks ago, or this morning at 6 a.m. At 6 a.m., So I was really, really pleased. I think they did a great work and for me what was really important was really to show both sides.
Okay.
Showing, yes, we're excited. Yes, we are able to help patient.
Right.
Yes, and in the segment, so you follow the patient I showed you at 39 months, which is now retired, we're cardiologist, and so I can talk about it. He is on TV. If you want to see, he's on the website of 60 Minutes. But so he's enjoying his life as a retired cardiologist. You followed this young woman, the first patient we treated, who is now graduated from nursing school and working as a nurse, and despite a diagnosis of glioblastoma. And so you see the patients that have a good life, but you also show the inflammation and the swelling and the toll it can take on patient, and the fact also that some patient passed because some patient decided that it was just too much on them to deal with this tumor, deal with this inflammation, and decided that they had to just go with comfort. So I think I was really, really, really pleased with how it ended up because they saw both sides.
What was the reaction? Like, what was the public's reaction to the?
So that's our website. We crashed the website. So on the first night, we crashed the Duke website. So it's air on Sunday night.
Not a typically heavy traffic website night.
Not for a brain tumor center in North Carolina, you know. So we're in North Carolina. We're the biggest, even if we're in North Carolina, so we're not in New York or Boston or something like that, or Montreal. I should not forget home. You know, we are the biggest brain tumor center in the United States in the number of patients we see. We have normally about 40 hits on our website by night. On Sunday night, we have over 450. The whole Duke system crashed because then the whole Duke system had over thousands of hits on the website.
Wow.
We thought we were so good. We had hired an extra receptionist to take the phone calls, and we thought, we're so smart. We have 2 receptionists to answer the phone.
Just in anticipation.
We're doing such a good job. Yeah. And then we ended up, we needed 7. So
7 receptionists?
7 receptionists answering the phone because we had over 1,000 calls the first 2 days, and then, you know, and then over hundreds and hundreds of calls the weeks after every day. So
what did people want to know? Like, why were they calling?
And so very interesting what they wanted to know. And I think that's why I have this slide dividing it into different groups of what they needed to know.
Okay.
On top of people, first the physician calling us.
Really?
So, and just by the way, for you fellow Canadians in there, on top there is Dr. John Simpson. He's a fellow Canadian from Manitoba, and he's our chief of neurosurgery at Duke. So, with our residents. Physician, very interesting. So the physicians were calling saying, I haven't seen the 60-minute things. My patient kept asking about it. What is that polio thing? They all want me to give them the polio vaccine. Why should I give the polio vaccine to my patient? It's like, they don't need it, won't work. That's not what they need. And here is the science. There was also a very interesting, a lot of oncologists or neurologists that will call and say, I feel really bad. Because I will tell my glioblastoma patient, you know, even with the treatment, this is a very stubborn tumor, very aggressive tumor. You'll live 1.5 years. Why you don't just go home? So there was a lot of physicians calling and saying, I didn't treat my patient properly.
And they felt bad.
They felt bad. I mean, you know, the role, you take an oath. You know, the oath, the Hippocrates oath, the first thing is the oath, that is, do no harm.
Do no harm, and here they are.
And then they're like, oh, I was thinking I was not doing harm because I was not putting them through the stress of treatment with a very bad cancer.
Right.
But then suddenly, no, I could have offered them treatment.
But they couldn't really, could they?
Yeah. I mean, you know, and that's why referral. So I think, so one of our work is referral, you know, referring patient to clinical trial. I think that's education. So one of our role is education of other physicians. You know, think about clinical trial, refer patient.
So what about the other public or patients?
Our patients, my patients were very excited. They were like, I kept bragging, it's my doctor, she's on TV. You know, so patients were really proud. So they bring me like Hollywood glasses. They call it the Hollywood glasses with sparkling on it. So they're very funny. Other patients were upset and saying, why you didn't offer me polio?
Right.
And so a lot of education on the patient. This is research. It is a new treatment. We need to be very careful on who is selected, who is it safe to inject the tumor with the polio virus, because if, of course, the tumor is in the speech center, I don't want you to lose your ability to speak.
Okay.
If it's in the motor control, I don't want to paralyze you.
Right.
So a lot of education about the patients that were angry.
Wow.
And then the other thing was, and that's the big picture, because a lot of patients with other type of tumor saying, why are you treating 1% of all the cancer? Glioblastoma, it's less than 1% of all the cancers. Why are you not taking care of my breast cancer or of my lung cancer? And really, so a lot of the calls were about that. And really education of them of saying, we need to make sure we do our homework. We need to make sure we did all the work in the lab to back how to treat, to support that, yes, it is safe to treat a breast cancer or a lung cancer. I would say polio going to the brain was a no-brainer because, I'm sorry, because I was not intending to say that, but because the polio loves the nervous system.
That's what it attacks,
exactly,
right?
That's what it attacks.
For.
Exactly, and we were paying Dr. Gromeyer's salary, so that's the other thing also. But the other thing was really, exactly, we need now what he is doing and what Dr. Gromeyer is working, this team are working on tirelessly is really bringing the next type of tumor.
So what would be like the biggest challenge then? Like the biggest challenge for you as a neuroscientist, as a researcher to communicate this research and this treatment?
Biggest challenge, I would say managing expectation and managing the fact that, again, the first rule in medicine is do no harm. And so, and explaining to patient the fact that we need to make sure we're safe. And we are regulated by, the Food and Drug Administration, the FDA, and there is the equivalent in Canada. And we are, so we need to make sure that the treatment we bring are safe. It was really hard for my team, I must tell you, for our team. The family will call and put the child on the phone crying and saying, why are you not treating my daddy? My daddy will die because of you. So of course, we all want to help. And my staff was crying. And so I think managing expectation, managing help, help bringing to the public the fact that, yes, it's interesting, but it needs to be promising. But we need to have the right timing. And I would say my only regret of the whole 60-minute segment, and they know, was, because I still talk with them, was really the fact that, so at the end, Scott Pelley asked Dr. Gromeyer, are you going to go with other tumor? And he says, yes, we're working in the lab with breast and lung. And the way I think that it ended really rapidly, it's like if it was like tomorrow we'll have it in the clinic. Right. And so managing expectation.
How long does it take? Like you're saying they're testing now for, you're in trials, I guess. Are you even in trials for breast cancer tumors? No, you're not even in trials.
And we won't be able to be in trial for a couple of years, many years. We're still working in the lab again, tirelessly, trying to figure out what would be the right way to bring it, because you need to figure out. So I would say the good thing about glioblastoma is that it's really only in the brain. It's very localized to the brain. It doesn't travel outside of the body, so the brain is protected. So glioblastoma will not travel in the lungs and the liver, and so we don't have to worry about metastases, which is not the case with a melanoma or breast cancer or lung cancer that travel, and then you worry, which tumor do I treat? Do I treat every tumor? Or will only treating one tumor, the immune system will be strong enough to go cure that. So, it is a lot of work, so that's what we're doing. And just the example, so here, I brought you the timeline. Sorry, I went too fast there. But the timeline, for us to bring it to just brain tumor, where a doctor made the discovery in '94 of this, work with the NCI, genetically engineer the polio virus. So that was 94 that it happened.
Wow.
And then we had to do all the toxicology studies. So we had to prove that the new genetically engineered virus was stable, that had no way to learn how to become polio again, that it will never learn again how to become polio.
Because viruses do
They
adapt, don't
they can adapt, they can mutate.
Yes.
So we needed to show that the construct we had was really, really stable.
And that it wouldn't change back.
And that it wouldn't change back. And then once that was done, then we needed to prove that it was safe, and when we would inject it in the brain, we will not be triggering polio, and we will not be, making everybody paralyzed or trigger the epidemic. So we had, a lot of homework to do. The study, so 94, the discovery.
To 2015.
Yeah, when I left Quebec and went to train in North Carolina, 2003, I knew they were treating monkeys and curing monkeys with the polio virus at Duke. I already knew that. And I was open, and by that time I'd grown up enough that I was the one in charge of clinical research at Duke. So I'm the one who started the study in human in 2012.
Wow.
So
it is a very long process.
It is a very long process.
Listening to you this morning really has made me wonder if we as science centers, and I'm showcasing the Franklin Institute's giant heart as a representative of we as science centers, if we need to be playing, or if there's a greater need, I guess, for us to probably tell the broader story of scientific breakthroughs, of medical breakthroughs, perhaps more importantly, the process behind these medical breakthroughs to really help our public, our audiences, to help manage expectations.
Exactly. I think that, if I look at it as, a physician, and as microphone is not always working, I'm sorry. If I look at it as a physician and as a person, just someone watching the news also and thinking about other discoveries, is really how to manage expectation, because every day we're being informed of science, this, and then it changes all the time. So really, I think exactly help from the Science Center and how to manage expectation, how to understand all the processes, all the work going behind the scene is very important.
Giving our audiences perhaps a better understanding of the processes that are behind the seemingly simple headlines that they are exposed to in the news. Thank you so much, Dr. Desjardins. That was absolutely fantastic.